anti-advocate. You need to you need to acquiesce. Okay, so if there are no other nominations for clearance, I'd like to hear a give me a sign yes for approval of clearance. Approval by saying yes, or do you want to do a roll call? What have you done in the past?
Just done a voice.
All right, voice. Yeah. All those in favor signify by saying aye.
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 Opposed? Motion carries. Vice Chair for the HHS Committee. Nominations.
Say, do we need to make sure we have a quorum, or do we have a quorum?
That's what I was just looking at. I'm wondering if we do. Let's see, 1, 2.
Just so we're not acting out of order.
I actually don't know who's on the committee, so.
Yeah, I'm not sure we have a, I'm looking. 1, 2, 3.
Hang on, here's somebody coming on board.
There's 19 participants right now.
How many board members though?
Steve is here.
And there's Matt McKenzie.
Bill Metzinger. Steve. Bill.
Laura Cruz.
Laura.
Matt Horning here.
Yeah, I think we've got 6 that I can count.
Matt McKenzie.
Actually, so before we go any further, Terry, why don't you, since you have the list in front of you, why don't you take a roll to make sure that we're recording a quorum for the approval of the chair?
I don't know that I have that list at my fingertips. Let's see.
I could read it off of the minutes.
That would be great, Laura.
That'd be fine.
Clarence Campbell, Matt Horning,
Right hand, we're going to take roll, so we want people to say yes or no.
Clarence,
Are we voting? Yes.
We're not voting, we're actually just taking
yeah.
attendance to make sure that
Yes.
the vote is certified by a quorum.
Matt
Here.
Horning,
Here.
Dr. Keller, Dr. Keller, Bill Metzinger,
I can see Bill.
Bill is
On.
here. Yeah.
okay,
I think he's just on mute.
yes. Bill, you're on mute. Can you say hello? Thumbs up.
Hello, this is Laura. Sorry, my computer would not connect.
We're just doing roll call, Laura, so.
Matt McKenzie,
Can you hear me now?
you can.
Yes.
Yep.
All right, here.
Laura Negro,
Here,
Laura Cruz here. Steve Waby,
Here.
Charlie,
He
Charlie.
called, he's confused.
Joyce Cabasa. Joyce, and that's all I have on the list.
Okay, and so how many present?
7, so we have quorum.
Good. Okay, so thank you for making sure we do this and record this properly. So those who just joined the meeting, we basically asked for nominations for chair. Clarence was nominated for chair. There were no other nominations. And with that, we will basically, again, take a voice vote for chair. All those in favor signify by saying aye for Clarence for chair.
Aye.
Aye.
Opposed? All right, Clarence is the chair, and we're looking for nominations for vice chair.
I would like to nominate Laura Negro.
All right, Laura, is there any other nominations for Health and Human Services vice chair? Any other nominations? All right, with that, we will take a vote. All those in favor signify by saying aye for Laura for vice chair for Health and Human Services.
Aye.
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 Opposed, same sign. All right, congratulations, Clarence and Laura. With that, then I will hand the meeting back to Clarence.
Can I just interject that you need to indicate which Laura? There's two Lauras here.
Laura Negro, sorry. For the minutes, Laura Negro.
Okay, next item on the agenda is the approval of the minutes of the last meeting.
I move to approve. Laura Cruz.
I will second it. Bill Metzinger.
Is there any discussion? Any additions or corrections? Otherwise, all in favor signify by saying aye.
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 Opposed? Motion carries. Public comments. Any member of the public online here that wishes to make some comments to the board?
This is just Clark. I'd like to just make one just highlight for the committee. I'm trying to get all of our committees to record their meetings, and they go on our YouTube channel. So we have the Ashland County YouTube channel. So I want everybody to be aware of that your comments are going to live forever on the internet. So make sure whatever you say, you're willing to stand behind on social media. So.
Any other public comments? If not, we'll move on to the next item, which is COVID-19 update.
So that'll be Liz Zott. She'll give the update on that.
Hello. So for our update for Ashland County, we continue with 3 positive cases. 2 of those cases have been recovered for an extended period of time. The last of the first 2 positives was actually diagnosed back in April, so they've been recovered for quite a period of time at this point. I apologize for background noise. Our 3rd positive case is recuperating at this point. We continue to be in daily contact to make sure that they are receiving the supports that they need to make a full recovery. Recently, there was mass testing in Red Cliff. There were 352 total tests done in Red Cliff. All of those results have returned as of negative so far that I'm aware of. I have not heard anything contrary. And then I just wanted to touch base as far as antibody testing. Antibody testing is available in our area. However, I would like to caution people that antibody testing is not diagnostic of COVID-19. Positive antibodies do not necessarily mean that you have immunity to COVID-19. There is the potential for reinfection because the research is still out, so it's not for certain that it offers immunity at this time. Red Cliff Clinic did actually do facility-wide testing for all of their staff, and all of them did return as negative for antibody testing. And I think that covers a brief update at this point. If there's any questions.
I think the other thing that to add on to Liz concerning the antibody testing, because it's not a diagnostic test, most insurance companies will not pay for that. So if you go in and you ask your clinic to give you an antibody test, even if they agree to do it, you may end up actually paying for it yourself.
Any questions for Liz? Next item is 2019 annual report.
So you should have all received that or had access to the link for this. And so hopefully you've had a chance to look at it. If not, you should have a copy of it. We will just kind of briefly go through each unit, and each unit will just give a brief kind of overview of some of the things in their report. And then of course, if you have any questions. So we can start with Adult Services Unit.
Hi, I'm Laura Compton. I am the Adult Services Supervisor. So I am just going to go over the statistics. You guys can read into it more, and if anyone ever has questions, please feel free to reach out and contact me. In 2019, we saw a significant increase in our Aging and Disability Resource Center referrals. We went from 137 referrals in 2018 to 247 in 2019. So the girls have been really busy, but that's working with our populations of either elder or people with disabilities and looking at whether they would qualify for a long-term care program and or talking about different resources available in the community. And we have 2 staff that do that. They also completed 96 long-term care functional screens, which is a screen that has to be completed to determine eligibility for either a managed care organization or the IRIS program. And that was an increase of 30 screens from the previous year. Our emergency detentions with our mental health and AODA remained the same. It was like a difference of 2 between the 2 years. We did see an increase of recommitments. With the new judge, we've seen that they've gone to 6-month commitments instead of recommitting someone for a year. And so that has been an increase in court time that we've seen in 2019. CST, which is our coordinated services teams, served 2 additional families, so they served 22 in 2019. Our children's long-term support program remained the same from 2018 to 2019, and so that program is working with 22 children across Ashland County. Our adult protective services reports for adult abuse and neglect, we went from 112 reports in 2018 to 116 in 2019. And then we had a decrease in representative payee clients of 10 clients. And we have seen a decrease because a lot of our referrals have been people with significant mental health issues that tend to take a lot more time than some of the clients we've served in the past. And so we continue to be able to meet all of those needs. One of the big things that we were able to accomplish in 2019 was working with our local law enforcement on having them complete alcohol and other drug holds. And so that makes a big difference because in the past, anyone that was at the hospital would have been placed on an emergency detention, had to go through the court process, and then usually those were dropped. And so that was taking a lot of time from both the court and our department. And now law enforcement is utilizing the alcohol and other drug holds to keep a person at the hospital for 72 hours so that they can receive treatment, and then they are able to go back to the community. And so that was one of the big takeaways I wanted to let you know. Down and dirty, does anybody have any questions? Okay, thank you.
All right, next we have Kelly with our child support unit.
Can you hear me?
Yep.
Okay, good. So my name is Kelly Madej. I'm the child support supervisor. Quick rundown again of what we did in 2019. We had a lot of changes. Darlene retired, Tracy Beyersdorf retired, and along with them left years and years of knowledge. So we are a pretty new group, don't have a lot of years under our belt, but we are going to do, we're going to do good things. Changes in child support. In 2019, the Bureau of Child Support started discussing right sizing orders, which means it's up to the county if the county wants to do it or not. But basically what they were saying is going by the state guidelines of 17, 25, 29% as they have more children, it was causing the non-custodial parent to not be able to live on their own. Like basically they can't live on their own because they're paying so much in child support. So by right sizing a child support order, it allows the child support specialist, so it allows us to look at the whole picture of the non-custodial parent if they're contacting us and talking to us and working with us. Sometimes we don't always have that. They don't always do that. But if they are, we will look at things like how much do you pay in rent or your house payment? If they're working, what is your vehicle payment? Do they receive food share or not? Or are they buying all their food themselves? Or is the non-custodial parent supporting other children in their home? And then we'll right size the order to something that they can pay and still live on. So that's been really positive. Our county has jumped on board with that. And so has our family court commissioner and our corporation counsel, which is really good. I think it's a really good thing. We continue to work with Northwest SEP and Workforce Resource. The family court commissioner will court order the non-custodial parent to enroll and participate in those programs as part of their purge conditions for contempt. So if they're found in contempt of court for failure to pay child support, that is part of their purge conditions, that they have to enroll and participate in those. And if they don't, then we can put out a warrant for them and things like that. So it's been really good, and we've seen good success with that. Onto the funding, and you can take a look at it. Child support used to just get a lump sum of funding. It's now based on performance for certain categories. Court order establishment rate. To get the full 100% funding, you have to reach 80% or more in your county. So you can see the comparison between statewide and Ashland County. We do meet it, in court order establishment and paternity establishment. We do not meet it. We have come up in arrears collection, and we are even higher than 60% right now. But we do struggle with arrears collection just because we do have a lot of poverty and drug use, and that we're a poverty-stricken area. Current support collections, we also struggle in that area, and that is making sure that we collect current support every month so that the entire order is being collected. However, with all that, during the 2019 federal fiscal year, we collected and dispersed over $9 million. So we're pretty proud of that. We also collected $14,399 in GovPay payments, so in credit card or debit card. And thanks to the treasurer's office working with us, we also collected $17,972 in cash that was paid right at our agency. That's about it. We're working on getting our numbers up to the 80%, and that's kind of our goal right now. Does anybody have any questions about anything?
I have a question. This is Bill.
Okay.
If an individual doesn't pay child support and lands up in jail,
yes,
who pays for that?
You mean if they're sitting in jail?
Yeah. Do they get charged so much for sitting in jail or not, or what? Or does the county pick it up, or what?
I'm assuming it's just like any other incarcerated individual. So I'm assuming, I don't know who pays for people who are incarcerated. Sorry, I can't answer that, but it's just like anyone that got arrested for stealing or anything else.
Have they arrested anybody in Ashland County within the last 2 years for being late in child support or delinquent?
Oh, yeah, we have people arrested weekly. Yeah. Bi-weekly. Yeah. Lots. And it's not that they don't always sit their time. A lot of them they purge, they call us and we make a deal. So if the bond amount is $1,000, they may call and say, hey, I can come up with 500, but I can't come up with with 1,000. Will you take that? And 9 times out of 10, we take what we can get, unless to get money coming in on that case, because they have a warrant out because they have not been making payments. So there's no income coming into that household, the child's household. So most of the time we take what we can get.
And during this COVID issue, we have basically limited or tried to limit the amount of people coming into the jail just to protect the population and our staff. We have had, we've gone down to a low census, down in the like 22, 24 people in the jail. And we have seen a recent uptick over the last few weeks. I think stimulus checks that people have got have been maybe used for nefarious activities, or people find out they don't love each other as much as they used to. And our census the other day was at 41 people. So it is ticking back up a little bit.
Currently, due to the COVID, any warrants we had that were active were dismissed due to the fact that they didn't want new people coming into the jail. And currently we are not putting out any warrants due to COVID at this time for child support.
I have another question. This is Bill. Do you garnish their income and state and federal income tax?
We do. So if they fall behind more than $500 in arrears, which is unpaid child support, they automatically, it just goes right through our system. They automatically are certified for federal and state tax intercept.
Thank you.
You're welcome. Oh, anyone else have any questions?
Okay, thank you, Kelly. We'll go to Jenny in Children and Families Unit.
So for 2019, the total number of calls that we received was 844, which is an increase from 2018 numbers. The total CPS reports that were received of those 844 calls was 293 reports, 122 child welfare reports, which is a services report that's used if someone is calling specifically looking for services for a family, so not alleging any sort of child abuse or neglect, but really looking for like mental health services, that sort of thing. And the total number of juvenile court referrals was 82 in 2019. We had 59 children who were placed out of the home through CPS cases, and that includes the numbers both for Ashland County Human Services as well as what the Bad River Indian Child Welfare has placed out of the home. We also had 5 additional youth who were placed out of the home under youth justice cases. In our CPS cases, the majority of those kids remain in kinship placements. I think that's one of the things that we have continued to do really well in our agency is be connecting kids with their families. So when they're separated from their parents, still having them connected with some sort of family, so they're not being placed with a stranger. Sometimes that's beyond our control and they do have to be placed in a foster home, but we've done really well in having the overwhelming majority be kinship care placements. We continue to see a lot of our cases have drug involvement, mainly methamphetamine. There are some cases that have heroin involvement as well. And as we've talked previously, the treatment options for methamphetamine are just not as effective. And so we're seeing a lot of these kids remaining out of the home for extended periods of time, and we have to explore alternative permanency options, which include guardianship and TPR and adoption. So the federal requirement is if children are placed out of the home for 15 out of the last 22 months, we have to pursue TPR unless there is a compelling reason why we do not. At this point, the only reason that we are not pursuing TPR for most cases is due to children who are Native American, and that is because the Native American culture does not believe in terminating parental rights because they do not believe in severing that parental connection. The other two big pieces for our case, excuse me, I should back up here. We do have some, we have had some emergency detentions for our youth, but we did see those numbers decrease slightly in 2019. Our youth justice and SPARK programs are our other two programs that we have within the agency. We've had really great success in the SPARK program, as Scott has explained to you guys throughout the last year, and he'll be giving you an update of where things are at now. The youth justice program, we had hired a mentor, or excuse me, a grant coordinator last year. That person left that position, and now Scott has taken on that role as well. So we're figuring out what that program is going to look like after this year when the funding expires. So overall, our caseloads remain high. But the staff is very dedicated to doing what needs to be done, whether it's the documentation in the state system or documentation for courts, seeing children face to face, meeting the requirements that we have. Again, in 2019, we hit the federal benchmark for face-to-face contacts for children in out-of-home care. So that was another big accomplishment for us. So I don't know if anybody has any questions. Scott would be able to speak more so on the specifics of the SPARK program. If there's anything, any specific questions on that, he'd be the one to answer those questions. Any questions for me?
Thank you, Jenny.
Thank you.
Okay, next we have Val with our community service programs.
Hi. I think all of you know the biggest change in the program in 2019 was the county decided to bring both the CSP, Community Support Program, and the CCS, Comprehensive Community Services, in-house. And what I'm happy to report is, even though there were challenges along the way, is that there were a significant increase in the number of people the program supported in 2019 versus 2018. There was a 30% increase in 2019, and an even bigger increase in the number of children served. And there was a 42% increase in the intakes in that CCS program. The CCS program, as you can see there, serves a lot of people with mood disorders and or substance use. Where DSP serves more people with thought disorders. It's a little bit of a different program. The CSP has a heavier emphasis on nursing services and psychiatry, where the CCS has more of a focus on helping people get a life worth living. They'll both do that, but it's really focused on connecting people with employment, housing, therapy, substance use counseling, daily living skills, peer support, whatever it is that they need. In both programs, we have a high number of people that have both mental health and substance use issues. And I think that's it for an overview. Any questions?
Val, I have a question. When we made that switch over from New Horizons to the county, I know there was a lot of concern among the clients about how that was going to take place and how that was going to affect them. Has that gone pretty smoothly?
At the time, the county and the program did a number of things. Mailings were sent out to folks to try and keep them in the loop as to what was happening. When we knew what was happening, and things changed on a daily basis for a little while there. So it was difficult for both the program, the county, and the participants. The county also had some listening sessions in which it was open to all participants to come in and kind of talk through things, hear what the participants were concerned about. Participants could hear from the county's perspective of the things that they were putting into place. At this point in time, there are no longer any issues associated with that transition. That's all gone away. And of course, I can speak more about current issues, which of course is COVID-19.
Val, this is Laura Cruz. I'm just wondering if there's been a comparison with the raw numbers and percentage in comparison to some of the other counties, if we're very disproportionate, or just that kind of comparison.
Sure. Yeah, so every year, both the CSP and the CCS do what we call a state survey, in which every program answers the same questions, and the questions themselves stay pretty consistent over time, except this year, of course, they're adding new questions. But the state publishes a document, but they're usually a couple years behind. I think the latest document I saw was dated in 2017. And then that is a good opportunity for us to compare ourselves with the other programs. Across the state, the CSPs tend to have people with thought disorders, just like we're seeing. There tend to be more males, and there's I believe we have a higher number of people with both mental health and substance use issues in both programs, though that issue is significant throughout the state. The CCS, again, our numbers are very consistent. And in addition to that, there is a regional work group for CCS. In 2019, for a while, we were meeting monthly. And then we moved to quarterly. We're now meeting quarterly. And that gave us an opportunity to actually sit down and say, hey, what are you guys doing for this? And what are you guys doing for this? And it was a really great way of networking. And since COVID-19 started, the state now has a weekly call for both CCS on every Wednesday afternoon and on CSP Friday mornings. And that, again, is another, in addition to hearing from the state, it has been a great way for us to network and find out what other programs are doing and whatever it is we're concerned about. It doesn't even have to be COVID related.
Thank you.
Any other questions?
Thank you, Val. All right, and next we have Melanie in economic support.
Good afternoon. Can everybody hear me?
Yes.
So I'm new to this whole process. This is my first time ever experiencing the annual meeting. So one of our biggest accomplishments, I guess, we changed over staff in our unit this past year. I'm the new economic support supervisor. We also hired 2 new staff within the economic support. So we have 8 economic support staff, and then we also have 1 half-time certifier in Ashland County. So this past year in 2019, we processed 880 energy assistance applications, and that total number for those benefits for that program was $579,347 for those regular benefit amounts. In crisis, we issued out $79,520, and we also they replaced 14 furnaces and 38 repairs to furnaces in 2019. We recertified 5 daycares. Unfortunately, in 2019, we did not get any new daycare applicants. We still continue to work with the Northern Consortium. The consortium numbers, we answered 100,997 phone calls, processed 26,142 applications, 28,766 renewals, processed 77 fair hearings. Along with our fair hearings, we also process overpayments and fraud payments. For food share, our fraud unit recovered $361,074 in food share benefits. In the Medicaid, we brought in $1,489,105 in the Medicaid overpayment processing team. So those are kind of a few of our highlights right now going on in economic support for 2019. Short and sweet. Any questions?
This is Laura Negro. Do you have any idea why there haven't been any more applications for new childcare venues?
There's been a lot of changes in our childcare program in the past year, certifying. We used to have approximately like 20 to 30 certified daycares. We dropped down to, I think, around approximately 20 licensed daycares now, and to around 10 certified. It just becomes more difficult ever since they started the Young Star program. That has made it more difficult to gain pay through that program now. So it's kind of like we did out some of our daycare providers just because they don't want to go through the hoops that it requires. And in northern Wisconsin,
it created some barriers that some people just aren't willing to overcome. Okay. Thank you.
All right, thank you, Melanie. Pete, an update for fiscal? An overview for fiscal? Well, I think he's going to cover some of that when we get into staffing, so we'll skip that piece. And then Liz, just a brief overview for public health.
All right, so just a couple of updates for public health. Let me get my computer to go here. A few of the changes that we have ongoing at this point in time, our fluoridation program. So that's the program that provides funding to supplement community water fluoridation and also supplements for the school-based fluoride mouth rinse. 2019 was the last year of funding for that program, so that has actually been discontinued at this point. Birth to 3 continues as is at this time. Disease control and prevention, so our communicable diseases, more investigations ongoing for the 2019 year as compared to previously. One of the most significant diseases, communicable diseases that we did complete investigations for the 2019 year was actually chlamydia. It was actually 2019, we saw 61 cases of chlamydia throughout Ashland County, which was up from 36 cases the year prior. And just also along with the communicable diseases, we continue with the mantle TB, tuberculin skin testing. We completed 62 of those throughout 2019. No significant changes to our MCH or PNCC. Our child death review, which is part of the MCH program, we had actually completed a review in cooperation with Taylor County. We reviewed the 2018 drowning deaths of a family that happened out in the islands. An awareness campaign of Lake Superior water conditions was implemented from that. It was in collaboration with many local and state entities, including the Bad River Tribe. We did actually so far have one billboard posted, just kind of increasing awareness in a family-friendly way to be aware of water conditions prior to venturing out on the lake. We also actually have educational coasters, like drink coasters, to provide to businesses with fun facts on Lake Superior to just try and increase and start conversation of people visiting the area, as well as for locals, just kind of fun facts that people might not be aware of. Those have not been distributed at this time. However, due to COVID, they are not laminated coasters, so we can't put them out just at this point in time. Our immunization program, we continue with the vaccine for children and vaccine for adult programs. We actually in 2019 did start a jail immunization program. Initially, that program started with just offering the hepatitis A vaccine. With the first clinic that we held at the jail, I believe we had 40 individuals immunized the first time around, and it was a pretty good turnout with every clinic thereafter. We did actually expand the immunizations to include not only hepatitis A, but hepatitis B, the measles, mumps, rubella, tetanus, Tdap, so the tetanus, diphtheria, pertussis, and then also the HPV vaccination. Family planning and reproductive health program, we did receive the Get Yourself Tested grant. So we worked in cooperation with Northland Counseling and WITC. There were numerous Get Yourself Tested events that were held at both campuses. Northland College was the more frequent of the events. So you can actually see our STI testing, so sexually transmitted infection screening. We had a significant increase in participation for that last year, especially for testing included screening for chlamydia. Individuals that did test positive, we then followed up to make sure that the individual and any potential partners also received the appropriate treatment and any education necessary to try and prevent further spread. I don't believe there were any significant changes as far as environmental health. Water quality, beach monitoring is ongoing. The childhood lead program, we continue with our routine monitoring for the childhood lead program. In addition, for 2019, we were able to become a pilot site for a new program that they are working on through the Lead Safe Home program. We received approval for additional training to local contractors to provide them with the training for lead safe home renovation and lead safe abatement work. We actually were able to begin the training in the spring of this year. However, due to COVID-19, the training had to be put on hold as well as the renovation work. When we're able to resume the program, it will actually provide funding to complete the training for contractors, and that includes not only general contractors, but electricians, plumbers, basically anybody that could potentially encounter lead hazards. It will also pay for all of the renovations that the home would require, the lab testing to verify the lead levels and clear the lead from the home, and it will also provide a per diem for the families to relocate from their home during the period of time that the renovation is being completed. And we also continue with our human health hazard investigations. We were consistent last year as the year prior with 15 investigations completed. And that covers the highlights. Does anybody have any questions?
Hey Liz, I got a message from Pete. Can you admit him to the meeting? He said he's on hold.
Let me see if I can find him.
Thank you.
Mama, kiss. Mama, kiss. Mama.
Okay, he should be coming in now. Sorry about that.
Thanks. That's why he was MIA.
Okay. All right, thank you, everybody. So that's the overview of the 2019 annual report. Happy reading. After you go through it, if you have any other questions, you can just give us a call and we'll try to get them answered for you. But I think it's a very concise overview of all the work that we did in 2019, and it shows really how hard our staff, not just the managers, but all the staff really worked hard. It's hard to be a small county and run all these many programs with as limited staff as we have, but they really collaborate well together and work well together, so we're very proud of them.
And thanks to the supervisors for putting that together. The next item on the agenda is the public hearing for purposes of taking comment on as we prepare our 2021 budget. I think we need a motion and a voice vote to go into public hearing.
I'll make that motion. This is Laura Negro.
I second that motion, Laura Cruz.
Okay, motion by Laura, seconded by Laura to go into public hearing. And I think it's supposed to be a roll call vote, but maybe we can just do it on a voice vote. Does that work? All in favor?
Aye.
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 Any opposed? At this point, is there anyone wishing to make comments to the board about as we prepare our 2021 budget? And it doesn't appear that we have anyone who appeared before the board. At this point, we will then recess the public hearing and continue on with our business. And if anyone does appear that wants to make comments, we can go back into the public hearing portion. Next item on the agenda is the Brighter Futures Initiative update.
Hi there. So program is off to, we're as you imagine with the COVID, we had to cancel our programming for the most part for the spring. And what we did at that point was we started to run some virtual programming online. Eventually the interest in that waned. And so we did lay off our staff for a number of weeks. And then what we did do is we started planning for summer with a new model. So I was realizing today that we are basically running our 5th Spark model since we started back in April, because we keep having to change the way that we run the program. So this year, this summer, we are running our program with what we're calling pods. We're putting kids in groups of 4 to 6. And we will be having those kids just spending time with their small group this summer so that we're not mixing kids up a lot. We have about between 65 and 70 kids that we'll be working with this summer. And which is great because last summer we ended up losing a fair number of our after school kids, and our demographics really shifted. So this year we really focused on keeping a lot of our after school kids who we feel are really some of our most at-risk youth, and really working hard to pull them into the program first before we opened it up more broadly. So we are launching next week. The staff is back. We'll start programming with kids next week, and we'll be running probably 8 to 10 weeks worth of programming this summer, with kids getting to go out with their pod 1 to 2 times a week, depending on which mentor they're working with. So we're excited about this model. We think we're going to get some really good relationship building with our kids. And, you know, and each mentor is going to be working with a small group of, they'll be working with those pods, probably 2 pods per staff. So each staff will get to work almost full time with only 8 to 10 kids this summer. So they'll really get to do some good, deep relationship building. So we're really excited about the new model. It's a bit of a brain bender to pull it off, but we're excited about what we're going to get to do. Any questions? All right. Thanks, everyone.
Thank you, Scott.
Thanks, Scott. We move on to staffing updates.
Okay, this is Carrie Barningham. I, for once, do not have many staffing updates for you. Usually I have a list a mile long. But our staffing, we've not had any turnover since the last time we met in April. Other than you did hear the Brighter Futures initiative, because they could not continue the programming, did have to lay some people off. That was short-lived, and the full-time ones are back already. So the main thing that we had, and we talked about last time in April, was of course Cindy Zock retiring and Liz Zott taking her place. And we initially, because of COVID, put off a recruitment for a nurse, because at the time we were thinking it would be pretty hard to find an RN in the period of pandemic where they're in high demand. So we put that off, but we also looked internally at some reorganization. And we shifted one person who was mostly doing environmental health back in functions. And so we did a recruitment for an environmental health and preparedness specialist. And we had interviews, I think we had 5 scheduled. Did we do 3 or 4? No, I don't recall. But we had some great candidates, and we actually made an offer of employment to a person today who was our first choice, and she's actually in Colorado, and she has some friends and family in the area up here, so she's going to be relocating and joining us towards the end of July. Her name is Rebecca Nielsen. She comes already prepared to be a sanitarian, so she's got a lot of great experience, and she'll be joining us. We'll be very happy to be full staffed again. Other than that, Pete, now that he's able to join us again, did have some staffing updates for you also, so I'll turn that over to you.
This is Pete Hurlevy. They're not updates, I guess, per se. We last summer, as we've talked about, we had a couple of people retire. The plan was and has been to replace those 2 positions with 1 position. We were short-handed there a little bit. We struggled to find the right candidate, so we were short-handed for a few months there. And now we've had this new person, Natalie Rooney, has been in place now for about almost 8 months, I guess. And so we were kind of treading water there for a while, but we are kind of catching back up, and the idea of going from replacing 2 FTEs with 1 FTE was partially predicated on being able to do some automation of some of our processes. And I'm happy to report that we are making good progress on that. So it's been a little bit of a rough patch for us, but we are right on the brink of getting to kind of where we need to be with 1 fewer FTE. So that's really good. That's all I had about that.
Okay, thanks, Pete. Any questions about any of the staffing updates that were mentioned? Then we'll move on to unit reports. Adult services.
So I wanted to let everyone know that in the past month, a grant opportunity came out to apply for additional funding for a substance abuse block grant. And that is the grant we use to be able to pay for people to go to residential treatment. And we just found out 2 days ago that we were awarded an additional $25,000 to be used in 2020. So we're very, very excited about that. And any questions about that? Thank you.
Children and families, family interaction alternatives to secure.
So over the past 5 years, we've spent $221,402 on secure detention placements alone. As we've been developing our Youth Justice Innovation Grant Program, or the Youth Wellness Center as we've called it, we've seen the potential that this has to make an impact on reducing future referrals to the youth justice system, out-of-home placements, and secure detention. While there's no way to completely eliminate out-of-home placements with this program alone, we see the potential to be impactful in other ways. As you may remember, this grant was for alternatives to detention. So we've seen that it could be helpful in other ways to decrease our caseloads overall. Right now, we're seeing not only a lot of new referrals to youth justice in our youth justice cases, but also multiple referrals on the cases we already have. So that means that of kids who are committing repeat offenses. By having another program to help support kids in the community, working on increasing skills and access to positive pro-social activities, we can decrease the number of repeat referrals and hopefully decrease the number of out-of-home placements long-term. When you consider the out-of-home placements for youth justice cases in the 5-year total, the total comes to $2,045,200. The Youth Justice Innovation Grant was a 2-year grant, which allowed us to purchase materials for the program and some of those really big ticket items, as well as develop a viable framework for delivery. With that being said, we will be seeking a half-time position to continue the work that's already being done in the program. So that's the piece on the alternatives to secure detention. As far as family interaction, as we've transitioned the way we do our casework over the past couple of months, we are continuing to discuss what social work looks like in our new normal right now. When Safer at Home went into effect in March, the state of Wisconsin Department of Children and Families recommended the use of technology for visits between children and their parents. As it became clear that this is not going to be a short-term situation, those recommendations have been reduced, and each county is required to develop their own plan for resuming in-person interaction. At this point, we have resumed in-person visits between children and their parents and have put several measures in place to help everyone involved remain safe. Those measures include providing screening questions to placement providers, making masks available for those who need them, and requesting placement providers to supervise the visits as well as provide transportation in an effort to minimize the amount of people interacting with families. Anybody have any questions?
Jenny, can I chime in real quick?
Yes.
I just wanted to mention, Jenny ran through the budget numbers that have come through for detention and alternative placements. And, as we were kind of crunching some of those numbers, I just wanted to point that number out a little bit more specifically, that while Jenny mentioned, we won't be able to eliminate out-of-home placements and secure detention. We do feel like there's a lot of funding that has been dedicated to those placements for the past 5 years, somewhere to the tune of around $500,000 a year that's being spent in putting those kids in those placements. And so we're really hoping that we might be able to utilize some of that funding in a more prevention, alternatives to detention program model to kind of continue the work that we're doing through the Youth Justice Innovations Program now. So I just want to make sure that we connected those dots a little bit, which is over the last 5 years, $2.2 million has been spent in kids out of home placement through that program. And we do think, while we can't eliminate all of that spending, we do think that we might be able to have some impact on that through the youth wellness program. But that funding, the grant funding for that is drying up at the end of this year, in the end of December. So we need to try and figure out how to work that into the budget moving forward.
Thanks, Scott. Community service programs, annual Q&A.
Yeah, so just a little update on the program. We have to take referrals and do intakes. Right now in the CCS program, we have 66 participants. In May, we did 8 intakes, and went into June with 6 referrals pending. The CSP program has 9 folks in it, and we have a referral pending there. There's been a lot of guidance from the state around different things that have to do with the program, and they've been very responsive of making changes so that we could continue to serve people in a way that was safe. And one of the things they did was create 2 documents. One that I refer to as permanent telehealth, which is where we can use a HIPAA compliant platform such as Zoom, like we're on right now, to provide services with folks. So what that might look like with somebody in this time frame is hooking up with them, and let's say we're doing some support with them in their home, and then we can hook up with them and coach them on a virtual platform with the same services that we were providing earlier. The other thing that has been put in place is something called temporary telehealth, which is that we can do the same thing with a phone. Staff and our contracted providers have gotten very creative. And not only that, I've seen participants who were kind of stuck in their ways and said, I can't do that, I can't do that. All of a sudden saying, oh, I guess I have to do that. And they have surprised themselves. So that's been real good. We have a couple situations in which it hasn't worked so good for them not to have that face-to-face. And so we're in the process right now of identifying the situations in which we need to up the face-to-face contact. There has been guidance from the state that actual handout that they've created for recipients of community and home services that we have mailed to all of our participants at the end of April, and then they also have guidance for us. So we are following that guidance. Staff are using cloth face masks from the mask makers when they go to see people, and they're wearing disposable gloves and meeting outside. So we will go to someone's house, we'll call them ahead of time preferably, but then knock on the door and step away from the door and maintain a 6 feet distance at all times. One of the things that the state had given us direction on is we needed signatures from everybody to switch their services from face-to-face to telehealth. And so we had to get signatures from everybody. At first they said we could do a verbal signature, and then they told us that verbal signature expires in 10 days. So we now, we have a process set up. We mail those documents out People can sign them and send them back. If they don't send them back within 5 days, we send them out another copy on day 9. We do contact them and arrange to go and meet with them face to face outside with those precautions on the doorstep and get that signature. We probably have about 90, I haven't checked lately. I'm thinking close to 95% of the signatures we need. With the rest of them, we have documented all of our attempts to get those signatures, and DQA has told us that they are going to take into consideration the work we've done to attempt to get those signatures, even if we don't get those signatures. Recently, we also mailed all of our participants Wisconsin Department of Health handout called A Guide to Sources of Support During COVID-19 for People Living with Mental Health and Substance Use Concerns. And it's a 4-page document that lists all the virtual supports and all the things people could think about in getting supports right now in a safe way, in addition to their CCS and CSP supports. That's it. Any questions?
Okay, thanks, Val. Economic support, temporary changes in ESS and WEAP.
We've had some pretty extensive program updates and economic support. For our food share program, under the Federal Families First Coronavirus Response Act, the Wisconsin Department of Health Services is able to give households eligible for food share benefits the maximum monthly benefit amount. For Ashland County, we had approximately 100 cases more than the average. We averaged about 1,100 cases per month. So we had about 1,200 cases. The average monthly benefit for the month for January, for 2020 has been around 200,000. The allotment for the month of April was $557,425. We don't have any data for May or June yet. The emergency food share allotment ends in June, so in July that regular benefit will begin again. So they'll get the emergency allotment for April, May, and June. Also with the food share, the U.S. Department of Agriculture, Food Share and Nutrition Services approved Wisconsin request to issue pandemic EBT benefits. PEBT benefits were issued for households eligible for free or reduced lunch. Households were eligible for $324.90 per child, and that was for the months of March, April, May, and June. So they didn't get that each month. That $324.90 was for per child for that entire period. For the Medicaid program, DHS temporary change program rules to help protect the health and safety of members. This includes maintaining healthcare coverage for individuals who are eligible during the COVID-19 public health emergency. Effective March 18th, anyone who is currently eligible for Medicaid as of March 18th or later must have their healthcare benefits maintained during the duration of the COVID-19 emergency period. The only exemptions that were allowed are death, moving out of state, and de-requesting. So healthcare for all individuals that were open as of March 18th and after have maintained that healthcare coverage since. For our child care providers were issued shares allotment from parents even when the child did not attend daycare. That transmission of those share allotments was automated and took place for the months of March, April, May, and June. Also, DCF received a grant. It's called the Child Care Counts COVID-19 Emergency Payment Program. 20 providers in Ashland County received $145,875 for a payment period of March 12th through April 11th. The categories for those eligible payments, one of them is funding to care for essential workforce families. That program was designed to support the costs of providing care for essential workforce families. The funds are to be used to paying staff, reimbursing families, and other allowable expenses. Also, there was another program under the incentive pay. The incentive pay program provides additional wages for child care provider and individual educators. Funds are required to be used to increase base during the state of an emergency for current employees, providers, and individual educators. Also, the last program under that Child Care Accounts COVID-19 emergency program was support for temporary closed child care programs to assist providers who were closed, and this program helps defray costs associated with retaining staff and reopening child care programs as Wisconsin's workforce returns to work. Funds are required to be used for reopening within 30 days of receiving that funding, and the money received is required to be used to paying staff, reimburse families, and other allowable expenses. Under the WEAP program, the Wisconsin Home Energy Assistance Program extended its regular applications. So we are taking regular WEAP applications through September 30th, 2020. The normal application process ends in mid-May. There's also been some extensive policy changes with the WEAP program. I won't go into detail on that. We've also, they've also added another program. It's under the WEAP program. It's called RAP, the Wisconsin Rental Assistance Program. In general, eligible applicants must be an adult Wisconsin resident with a household income at or below 80% of the county median income in the month prior to that month of application. And RAP can award up to $3,000 per household and can be used for rent, back rent, and security deposits. And just an example of that income median level, annual income of $28,673 for a household of one, breaking down to $2,389.42. And also during our processing, we had a decrease in our workload actually, and due to the workload decrease from the policy and procedure changes in food share and Medicaid, we were able to shift a couple of workers over to the fraud unit. In 2 weeks time period, we were able to work on the backlog of overpayment and fraud cases, and they were able to start the collection process of over $65,000 in that 2 week time period. And again, these were just from older cases. With all the changes that we had with numerous policy and procedural changes from each program, overall workers have done an excellent job shifting gears, providing members the entitlement benefits quickly and efficiently. And this emergency has had an enormous effect on our caseload, and it will have an enormous effect on our caseload for the coming years. Any questions?
Okay, thanks, Melanie. Now, child support updates.
Okay, so just some things that are going on in our office. We currently have, due to the COVID-19, we are not seeing individuals face-to-face in our office. There's just not enough space to social distance. So we continue to reach out to them via email and via telephone, and they can come to the door and we do talk to them that way, but we haven't had anyone in our office. We did not have court there was no family court in March and April. We resumed court again on May 1st, and it has been via Zoom so far. It's gone pretty well. It was a little bit of extra work for everybody, actually for Sid and Courtney, to get those notices out to everyone, letting them know that it had changed to Zoom and this was the information and this is how you appear and you can't appear in person. They did a phenomenal job of getting everything done. Right now they are both working in the office 5 days per week. And the rest of us are all coming in 1 day per week and working from home the remainder of the days. So we're each there on a different day. We did resume genetic testing and in our genetic testing room, just because we had some court-ordered genetic testing, and the company that company that the state contracts with had come out with guidance on how to do genetic testing a different way. So basically, they do their own swab. So the roles are reversed, and I'm the witness and they're the swabber. I'm the only one doing it at this time, just to limit the amount of people having to come in that close a contact with other individuals. We do require that they wear a mask when they come, and we do have it all set up where there are no chairs, and we go into the genetic testing room, and the table is about 6 or 7 feet long, and they are at one end of the table and I am at another end of the table. We have ordered some movable plexiglass, so once that does come, that'll help to put a barrier up between us in the middle of the table, just because obviously when they do the swab, they do have to take their mask off. But that has been helpful in establishing paternity for some children. Court is supposed to, still waiting to hear on 100% on this, but about 90% sure that we will be back in the courtroom as of July 1st. We haven't gotten the wording yet to put in with our notices, but we will be sending out notices to everybody. That is going to prefer that they appear by Zoom, but they can appear in person beginning July 1. And we've been in contact with the judge and the clerk of courts and everyone trying to get that organized. And it's taking a little bit more time, but the judge had to come up with a pretty significant, as I understand, plan in order to limit the foot traffic outside of the courtrooms. So with that came a change to child support time. It's always been Tuesday at 10:30. It'll now be Tuesday at 8:30 a.m. And possibly some dates that we won't be able to have it due to, I lost my train of thought, due to jury trials that they are behind on that need to come in. So we continue to work with the court and work from home, and it seems to be going well. And again, we are not doing any warrants or contempts at this time until the jails start taking new people. Does anybody have any questions?
Okay, thanks, Kelly. 2020 year-to-date expenditures. Pete.
Okay, let's see. I think Liz can share that. So yeah, this is the document that you want to be looking at. I think some of you are phone only. So what this is showing is for our annual budget for human services for 2020, our expenditures are budgeted to be about $8.2 million. Levy budget of about $2.2 million. And year to date, also for those of you who are maybe new or newer, the way that we account for this is expenditures are actual when I present this to you. Revenues are earned. So although we are a cash basis, we do cash accounting for your purposes, so you can kind of compare apples to apples. The revenue here is earned. There's nothing here so far. Again, early in the year, there's nothing through the month of April that leaps out at me. Once again, we've talked about this before. If you look at the levy line, the $2.2 million for the year, and to date through April, we had spent $315,000. That amounts to only 14% of the annual levy budget. And, you know, through April, we're essentially through a third of the year. Once again, the way the dynamics work with the funding for our programs is early in any given year, we're spending grant money. So the levy dollars that we use are really backloaded into the last few months of the year. So you can see the bottom line is our spending year to date overall is at 29%, $2.4 million of the $8.2 million. So there's nothing here that causes me any alarm. We'll be doing a little more analysis on the downtown programs, the CCS especially. I think they were what's key for that program is it's funded by Medicaid, and what is key there is billable hours. And I think even through this COVID situation, they were able to maintain their billable hours at a reasonably high level. But we'll be looking a little bit more into that. As always, if you've been on our committee for a while, the trick for the single biggest trick for us in human services is out-of-home placements, whether that's kids or it's due to mental health or substance abuse issues. Those are things that are quite expensive, and we have limited control over those things. One of the a bit of good news early on through April, just speaking of our placements in state mental health hospitals, so Mendota and Winnebago, our adults, I think we had, those are the hospitals where it's basically the cost is $1,000 a day. So a month is $30,000. In the adult unit, I think we had about in the neighborhood of $60,000 worth of cost there. But what really worked in our favor there is we had 2 people placed who happened to have Medicare. And so Medicare picked up really the bulk of that cost. So that was a real fortunate thing. And with our kids that have had to be placed there, you know, Medicaid has really helped us out so far in this year. We've talked about this before with those mental health institutions. The kids, Medicaid is applicable, and it's an allowable cost for Medicaid. For adults, once you get over, Terry can probably help me there. I don't know if the age is 18 or 19 or what the age is, but effectively between the ages of 65 and let's call it 18, Medicaid can't pay those costs. So in our situation through April, that's a good circumstance for us where the bulk of our costs through April were covered either by Medicaid for kids or Medicare for the adults. Other things that I happen to notice, I think that's about it early on. Again, there's nothing that's really a surprise. Sometimes as we look at these throughout the year, again, if you're relatively new, you might see we're comparing our actual revenues and expenditures to, you know, the budget that was voted on and approved last fall. So that budget stays fixed. What doesn't stay fixed for us is our funding. So, in other words, Terry and Jenny and Laura and all the managers are constantly on the lookout for new grants. So there can sometimes be times where our expenditures look like they're higher, and they might be, but that's only because we have found additional funding for to incur those costs. To maybe Scott Griffith's programs are a great example. You know, we a couple years ago we ended up with those great grants. Hired Scott, and he hired some people to run the programs. So both the revenues and expenses in that case would have been higher than budget, but they'd have no impact on our levy spend. So anyway, year to date, I don't see anything that jumps out at me.
Any questions for Pete? If none, we'll move on then to the written materials, which were emailed to us. Anything that we need to take particular note of in those written materials?
No, those are pretty much your monthly materials that go out. So unless you have questions, they're pretty much what you get on a regular basis.
Board member updates or possible agenda items for the future. Anybody on the board have any suggestions or anything you'd like to hear about?
Hey, Clarence, this is Matt. I guess I'd just be curious, Terry, or any other board members, for thoughts. I know there's all this protesting going on nationally, and I was talking with a police officer just a couple nights ago about ways that the county locally, you know, are there sort of creative ways that we could help our law enforcement officers deal with a lot of mental illness and substance use type problems in a more sort of partnered way. And he kind of was talking about, gosh, it'd be really nice to have, you know, the EMT right there with medication so that we could restrain these people with medicines like you do in the ER, as opposed to out in the field when we can't get the Ashland Fire Department to come because, well, that's a law enforcement issue. And I know we have this emergency mental health program, but obviously this would be kind of thinking outside of the box. And I don't have a firm idea, but I guess I think certainly the county board is probably looking at some of these things, because you think about budgets and we're always cutting both our budget and the corrections budget, and, you know, budgets are always tight. And instead what, you know, it's trying to figure out, yeah, no one's, or at least I'm not pushing for any sort of defunding movement, but this idea that how can we better support law enforcement, and possibly also with this idea that, yeah, possibly by getting ahead of some of this from a mental health standpoint, we're reducing downstream sort of negative effects for citizens, but also potentially even costs. So it's not a well-formed proposal, but I guess, yeah, I don't know where you want to go with that, Terry or Clarence, but I'll throw it out there.
So I can tell you, I really think we are ahead of the game as far as collaborating with law enforcement, because we have a work group that's been in existence now for a couple of years, and it's been put on hold now because of COVID, but you've probably heard about our safety plans and the platform to be able to have dispatch upload them for somebody who's having a mental health crisis, and they can on the spot at the time that it's necessary communicate what de-escalation techniques might work with that person. That work group has involvement from our county mental health and substance abuse programs. It has involvement from the hospitals, the schools, mostly the city police. I will tell you, we have not had a really good turnout from the sheriff's department, but the city police department is extremely involved, and quite frankly, they have the most of the emergency detentions and the most contact with people experiencing a mental health crisis. So I agree, and we certainly will continue to work on that. Like I said, everything was kind of put on hold because of COVID, but they are talking about initiating the trainings now for the safety plans, because we are still working towards that. And I think there's a lot of, and I will also tell you that I probably already told you this, but you know, some of the grants that I talked about over the last year were to fund the police department to have what's called crisis intervention training. You might hear it referred to as CIT. And so basically everybody that could and wanted to, and it was pretty much, I think, up to the captain, have that crisis intervention training for the city of Ashland, were able to do so through our grant, and they put in funding themselves. So the stuff that you might be hearing about as some ideas for, you know, the de-escalation training and things like that, I think, again, we're ahead of the game on that, but we still need to keep working on it. So I agree, and hopefully we can come up with some more creative ways to work together and collaborate, so that when people are having mental health or substance abuse kind of crises, that it doesn't escalate to a point where somebody has to use some kind of lethal force.
Yeah, and I will say I'm on the catch advisory committee, which basically is dealing with all the work that has been done over the last 2 years concerning getting the releases and these de-escalation plans and the communications. And so I'm on that committee and we obviously had to put that on pause due to COVID. The other thing you're going to be seeing, I basically am putting before the board on the 7th of July at our county board meeting. I want to create a tribal county relations committee. And so part of this is, you know, we want to make sure that we're working in concert and trying to stop a problem before it happens. And if we do have a problem, you know, what happens if it escalates? And so this committee will be formed with 2 county board members and 2 tribal members appointed by the respective chairs of those organizations. And then we will work together, and I'll probably be pulling in different staff, and we work on initiatives, or we work on guidance that this committee will give to the county board concerning collaborating and developing better relationships with the tribal government also.
This is Laura Cruson. I'd kind of like to jump in here, and I don't really know if it fits here, but I think it is a public health issue in that I think, I don't have the stats in front of me, however, law enforcement agents really do have high stresses in their life because of, you know, being in harm's way sometimes. And are we looking at how to help them with maybe potential substance abuse, mental health issues that may get in the way sometimes when maybe post-traumatic stress? My experience in working with the Ashland City Police Department with the police liaison officers has been really awesome. And yet I also know that, you know, they protect their own, and if there's an issue, they, you know, they don't seek help, from what I've heard and what I've experienced. And you know, I think we can hold in many hands that the community, there's mental health issues within any agency, whether it's teachers or, you know, law enforcement or social workers, etc., that there's mental health and substance abuse. And so how are we, or can we, either within the county or working with the city, try to provide some supports where maybe there's a kind of an unwritten rule not to seek help because you can't let your guard down, or something to that effect. And in addition to that, the institutional racism that is inherent in our system and is part of the problems that our counties face.
This is Laura Negro. Matt McKenzie and I went down to Superior Days, and during our lobbying, one of the things that we thought was a bigger piece that kind of envelops the two issues is to push a little bit on our state to help us with a regional facility. If our police department didn't have to be spending a whole day with an officer going down to Eau Claire or down to Mendota, then they would have a little more free time to do other things. It would take some burden off them. It would be easier for people to stay closer to their community where their support system is. So we have worked on some of those bigger pieces. That one's a little bit longer term kind of plan, but it's still another piece in that puzzle.
I'd like to add in on that. It's actually 2 officers, because when you transport somebody, you got to have 2 people there. And some of the other things that we've done that is not correct is when it comes time to negotiate wages with these folks, we ask them to do more for less. And that takes them away from their family even more, which adds to the problem. So, you know, but I'll say this, and I've worked within this circle for a number of years. I think overall, you'd be tough to find sheriff's department or police departments that are any better than ours. And, you know, I think it was pointed out, no matter what profession you look at, you're going to have a bad egg from time to time. And we shouldn't lose track that that's a very, very small percentage of what really is out there, and not overreact at times. Thank you.
Okay, so we can put this on our agenda for next time and follow up. I do have some updates as far as the children's unit goes, but nothing is fully finalized yet, but it should be by our next meeting. So we'll have that information for you. At least by then we can have discussion. And if I get information prior to that, I'll send some written notices with July's or August's written updates.
Can I just jump in here one more time? This is Laura Cruz. I want to be clear that I'm not bashing any particular group, and as a matter of fact, I'm working very closely with the school district of Ashland, where I work, because I recognize that there's a lot of inequality, a lot of institutional racism that many of us don't understand because of the lenses that we've we look through in our lives. Versus individuals who, maybe have mental health issues or aren't of the dominant society. And I see a lot of my fellow colleagues who, I worry about them, escalating things when maybe they don't need to. So I don't want to give the impression that I am against law enforcement, because that's not my experience. And yet, I think we need to look at all different aspects of this, because there have been issues in the past, and I don't think we should gloss over that without, really addressing the various sides here. Thank you.
Yeah, this is Matt again, McKinsey, and I just want to make clear that my comments were not directed at anybody on the board, but just as an overall general overview of what's going on in the world today.
Thanks, Matt. Appreciate
Any
it.
other board members have any input items they'd like to see discussed? Any other business to come before the board? I think at this time we should have a motion to go out of public hearing. I think we're still technically in public hearing, so we need a motion to close the public hearing.
I move to close the public hearing. Bruce?
I'll second that, Matt Horning.
Okay. Motion has been made and seconded to close the public hearing. All in favor?
Aye.
Aye.
Opposed?
Aye.
I think that I was to approve to close the public hearing. It just came a little late. Approval of bills.
That was put on there
Move to approve.
by accident.
Yeah, I think we kind of
off our-
went away from that.
Yep.
So we don't need a motion on that.
Nope.
Next meeting date is scheduled for September 16th. And at a place and time, or a place to be determined, I suppose, depending on
Yes.
where we are with COVID.
Yep.
There's no other business, then the meeting is adjourned.
Thank you, everybody.
Thanks, everyone.
Thank you, everyone.